Hi, my name is Dr. Misbah Khan. I am a dermatologic surgeon in private practice in Manhattan. Today we're going to talk about a liposuction revision case. This patient I treated about 9 months ago, and I want to go over the whole process as to show you and talk to you a little bit about what it entails to go through the procedure and what the procedure is all about. So the first picture that I'm going to show you here is our lovely patient. She's a 32-year-old beautiful girl. She had a Vaser liposuction done at another facility about, I would say, maybe 3 years ago or something, and that left her with some interesting defects. Let's just go over those. Here are two bulges that you see. These are the pockets of fat that retained and did not get better after the procedure, and they got worse over time. Over here is the mark where the Vaser liposuction cannula was inserted in underneath the skin to get rid of some of the fat in the belly area. And as you can see, the mark is still there. It's been more than 3 years now, and this little indentation, it got created along with the lines of where the cannula kind of went in. So there was a very deep indentation right above the belly button, and then as over here you could see there are two bulges, and then there's a little bit of a contour deformity over here along the waistline as well. So there was a little pocket and a little string of fat that was left behind over here. So those were the trouble areas. Now she's otherwise in a very good shape, and whenever she would wear dresses and stuff, then these bulges would pop up and the dresses would not look so good. And she was also very self-conscious of this indentation because it made her look like as if there was a very deep wrinkle right above the belly button, and she was concerned about it, especially when in a bathing suit or whenever she would go out with friends and stuff. It was something that bothered her. And the waistline over here is also not very contoured. Now when you deal with something like this where you have pockets of leftover fat, contour irregularities, and you also have indentations, then it's a mixture of different procedures that will be involved in order to how to fix this patient. So what we did was that I actually did a little bit of a microsculpting in these areas and microsculpted all along her waistline, and then we took out the fat that whatever we could get from these areas, and a little bit of a fat we also borrowed from the inner thighs, from her inner thigh pocket. And then we process the fat that whatever we take out. It goes through a system of cleansing and purifying and then getting compacted. And then we decided to use that fat, her very own fat, and recycle it and use it to fill in this defect. So I want to go through the photo with you as to how she looks like. It may not project very well on the camera, but here you can see that the bulges are all completely gone. The waistline has contoured, and this indentation got a lot better. The scar is still there, which she's applying a lightening cream on it to make that go away now, and it is a lot better. But you can see that the bulges, they have completely disappeared. Now let's take a look at her side by side. So these are her pictures. The arrows are pointing at the areas that we focused on and we treated. And these are her results 9 months after the procedure. So to sum it up, we have pockets of leftover fat, contour irregularities, and deep indentations. We fix them by doing microsculpting, refining the contour, make her waistline a little bit more sharp and coming together, giving her an hourglass body. And we used all of that fat and recycled it using a very highly sophisticated system called Pure Graft. And then we put all the fat back into these indentations. I hope you enjoy this video, and then you can take away a good home message that as to how these defects can be done. This is a very simple case and a good result 9 months post-op. Thank you.